buenos días tengan todos ustedes. Soy el doctor Oscar Valencia, coordinador de este espacio de educación médica continua. En nombre de la Escuela de Medicina y Ciencias de la Salud del Tecnológico de Monterrey, les doy la más cordial bienvenida a la sesión académica de pediatría. On behalf of School of Medicine and Health Science Tecnológico de Monterrey, I give you the most warm welcome to our weekly grand rounds in pediatrics. Now we're going to have the third of the series of developmental and behavior that we've been having in November. And to present our speaker for today, I'm going to give the floor to Dr. Juan Francisco Lozano. So, Juan Francisco, your mic is yours.
Muy bien, pues muy buenos días, muchas gracias por acompañarnos. Para nosotros es un gran honor tener el día de hoy a la doctora Jenny Radesky. Dr. Radesky, it's a great honor to have you here with us today. La doctora Radesky es profesora de pediatría en la Universidad de Michigan, en la Escuela de Medicina, donde ella dirige y es pediatra del desarrollo y comportamiento, dirige la división y el departamento. Tiene, pues, codirectora médica para la Academia Americana de Pediatría en el Centro de Excelencia en relación al uso de redes sociales y salud mental en jóvenes. Tiene numerosos proyectos de investigación fondeados por el NIH, en donde evalúa y estudia la tecnología, el uso de móviles, celulares en la interacción y cómo esto relaciona al desarrollo social, emocional y las interacciones con padres y niños. Es autora y coautora de numerosas publicaciones, pero las que más remarcamos para ella es pues el Policy Statement de la Academia Americana de Pediatría, que ha sido un punto de referencia en sus repetidas publicaciones, y es editora del libro, coautora y editora del libro de texto en Encountable Children, que es en relación a la pediatría del desarrollo. Tiene numerosos premios, es miembro activa de diversas asociaciones. Marcamos principalmente la Academia Americana de Pediatría y la Sociedad de Pediatría del Desarrollo y Comportamiento. Además de ser parte del consejo del National Academy of Science en Estados Unidos, en el comité de niños, jóvenes y familias. Entonces, Dr. Radesky, as I was saying, it's a great, great honor. You couldn't imagine how excited our public is to have you here. So we give you the floor and go ahead.
Thank you. Thank you so much, Dr. Lozano. I appreciate the invitation to be able to present this research today. I'm sorry, I will be presenting in English. I am not a Spanish speaker, but I appreciate that flexibility. I'm going to share my screen. Now, I'm also presenting today on behalf of the Center of Excellence on Social Media and Youth Mental Health, and as well as my research and clinical work at the University of Michigan. What has been great about working for this Center of Excellence is that we've been able to take all of this clinical knowledge and research knowledge and now translate it into resources for clinicians, for families, and we're working on more for schools this year. So I hope that this is a helpful presentation. I'll plan to talk for about 45 minutes and then answer questions. I have a few disclosures that I have received research funding in the past from Common Sense Media, who we do recommend as a resource through the center, and past consultant fees from a toy company. I am currently paid as a witness by the state of California and employed as a behavioral expert for the Federal Trade Commission, but I'm not going to talk about any of the policy things that are related to those. A little background on our center. This is funded through the U.S. government, the Department of Health and Human Services, and the Substance Abuse and Mental Health Services Administration. It's a 5-year grant. We just started year 3, and our goals are to improve pediatric mental well-being by reducing risks, leveraging the benefits of social media. So you could see we have a nuanced approach that is not all about risks and taking things away. We understand that social media is just integrated into our society in ways that it's very hard for everyone to just stop using it. But we want to build the capacity of people who work with youth to help mitigate social media's impact on mental well-being, help kids have healthier relationships with technology and social media if they choose to use it, and make sure that all of this is evidence-based, so that it is not just based on our opinion or our gut feeling or our worries, but is really based on what we know about child development as well as media use. And so my objectives for today's talk is to help analyze some of that research evidence that's gone into our recommendations, and then talk about skills. Every time I review evidence, I will also talk about skills. How can you talk about this with families in your offices, and show you some of the resources we've built through our center. I always like to start my talks by saying it's really normal to feel overwhelmed, anxious, frustrated, exhausted by this topic. Talking about screen time or social media addiction or any of these big worries that show up in headlines in the news can make families feel like it's hopeless, like it's too much to handle. So I want to discuss a few reasons why it feels so hard right now. First is that the adoption of technology has really accelerated. It used to be that a new technology like radio or TV took decades for our country, or this is global users, to adopt it. And then as things sped up with the internet and different devices and different apps, really now introducing a new technology, people want to get to scale really fast. The investors in technology want the lots of profits really fast. And that means that kids are using new technology before we're even adjusted to the old technology. And I have on here a picture of some of the technologies I grew up with, like landline phones or payphones. I have an 11-year-old and a 15-year-old. I was telling them about payphones the other day, and they were like, what? You just like picked up a phone that anyone else had used and put quarters in it? Floppy disks or iPods, right? So it's worth it to reminisce with kids a little bit about the technology that we grew up with and how it's very different than just Chat GPT or all of these AI tools that kids are now using, and recognize that while we can't know everything about new technologies, we can at least talk with kids about how it feels that this is moving so fast. And it can sometimes feel like it's very true that technologies are being released without double checking that they're safe for kids. And that is why kids can stumble into many difficult or unsafe situations if technology is introduced without a child health and safety team to double check. I also want to make sure during this talk, we're not talking about social media as a monolith, as one homogeneous exposure. Social media is so different. It's changed over time. It used to be that they were mostly chat rooms or places where you would post updates about yourself, or you would find other people who had the same interests or fandoms. But by the time from about 10 years ago, things started to be more feed-based, more algorithm-driven. There was more of an expectation that people were posting more content and everyone else is reacting to that content. And then there was a rise of misinformation, much more targeted advertising to try to know more about the user. So it's important for families to know that sometimes the way technology is designed can make it harder to parent around as well. And that social media can include things like Roblox or Discord or YouTube that our younger patients use. So we should start these conversations early and talk about what platforms are you using? What age did you say when you signed up for an account? Is your account private or public? Do you chat with other people on that account? These are questions I'll put later in my talk, but kids like talking about technology, so it's worth asking them open-ended questions to try to get their perspectives on how it feels and which apps are not good experiences for them and they'd like to take a break from. So just to sum up my introduction, parenting around media feels very hard right now because it's evolving and growing rapidly. We didn't grow up with these technologies. Business incentives lead to designs that keep users on longer. So, like I said, right now, the business model is to sell advertisements to people based on targeting, based on their online behavior. And so in order to make more ad money, you should keep people on longer. And that sometimes goes against what we need in families, like getting kids to sleep or sitting down and doing your homework without distractions. When things are automated, meaning a computer is making decisions, that can introduce random things that we don't want our kids to see. If you contrast automation to a community where it's all humans helping make decisions around a child, that's one real difference that families say doesn't feel good about technology sometimes. If a computer's making all these decisions, they would rather, like in their child's school, that the humans are making the decisions about what's best for their child. And then finally, these products are not regulated in terms of laws or enforcement. The same way the cars our kids drive, the toys they play with, the food they eat, all of those have safety things built in, and technology does not right now. So that's why our American Academy of Pediatrics is advocating for some tech legislation to make it safer. So I say this so that we can normalize with parents. This feels hard. There's a good reason. It's not your fault. They can help reduce some of that shame or blame that parents say is so common. Some parents say, I hate this topic. I'm so bad at parenting around media. And so I like to say, hey, there's a reason it feels hard. These tech products are designed to keep our kids on longer and us on longer. So we feel bad for staying on social media longer than we wanted to and didn't get enough sleep. So what we've heard back from pediatricians as they have tried out our approach is they say it really helps ease the tension in the exam room to just say, this is okay. It feels hard for a reason. Tell me about how you try to manage this. And you make it much more open-ended and understanding rather than a judgmental, you have to, enforce screen time limits and get those phones away from kids. So part of the reason we follow a more nuanced approach is because there's not a straight line between use of technology and social media and poor mental health. Now, I know there are articles and books out there that try to claim ever since phones and social media were invented, children are more lonely, children sleep less. Now, that's true. Those two things correlate. But if we pin it only on the phones came in and kids' mental health got worse, the only solution we have is we'll take all the phones away, which families say is not a solution for them. I say redesign the phones a bit too, but that's a whole other question to get more companies on board with giving our kids, starter phones that don't have everything in it. If you understand that technology and children interact in a really complex way, and this is what the evidence suggests, is that whether a child has a negative outcome or a positive outcome from their relationship with technology depends on a few things. One, what is that child's characteristics? So myself or Dr. Lozano, we always think about, we're developmental pediatricians, so we think, how is this child wired? Are they curious? Are they impulsive and risk-taking? Are they anxious? That child's characteristics are going to interact with the design of the media. Whether it has the sorts of, I'll talk a little bit about the designs that try to keep kids coming back more and more, or spend more money, or post more stuff. What sort of content? What does their algorithm know about them and then serves them in terms of content? So if a child who's very anxious about their body, they may get served more diet and fitness content, which can worsen it. And then these interact to shape whether media use or social media use is overall a positive or a negative experience for that individual teen. I'll talk a little bit here in a few slides about how for some kids it's more negative than positive, for some kids it's more positive than negative. And then none of this occurs in a vacuum, right? It occurs within the family context. How much media are parents using? How is the parent-child communication about everything, including media? It occurs in the school context. So is that child bullied in school? Then they're more likely to be cyberbullied. Does that child have a good peer group that all communicates well to each other? And then are they all able to say, all right, I'm not going to be on my phone after 9 or 10 p.m.? That sort of climate in school is more likely to help the child have a healthier relationship with peers online. And then teens also tell us technology is not only a potential source of stress, it's where they go when they're stressed out. So they say, if there is social unrest, if there is climate change stresses, then I go to social media to learn more about it, figure out how I can help, or just to calm down and escape a little bit. So we have to recognize that interaction between the child's mental state and how much media they use. So I get that this is complicated. I would never show this slide to a family and say, this is your child's relationship with media. But as scientists, it helps us tease apart, where should we act? What's going to be the most powerful way to try to help a family understand their child's media experience and intervene in ways that will really help? So we may say, okay, if your child is more anxious, let's build more coping skills for managing that anxiety that don't involve media. And maybe we look more at using apps or media experiences that don't lead to as much social comparison that feed into that anxiety, for example. So this is our framework that has guided a lot of our work in at the Center of Excellence. And what I'm going to do when reviewing the research today is to say, organize it by what we call the 5 C's of media use, which is what we came up with last spring in response to pediatricians saying, I always use the 2-hour rule. I tell parents this really easy to remember rule, but it's not working anymore. Give me something else that's easy to remember and is going to be effective. So we came up with a mnemonic, the 5 C's, to try to guide conversations with families. These are child, content, calm, crowding out, and communication. I'm going to go through them one by one, show you some research evidence, and show you some ways to use them to have conversations in clinic, or we have handouts that I link to in the end of this and that I can send after the talk. And I think we have translated them into Spanish as well. So I will get you those links after. So overall, the approach for office visits when talking about some of these 5 C's, you don't need to talk about all of them. It's not like a checklist of everything you need to cover in one visit, but it's a way to think about, like, how do I help this family approach media in a more healthy but nuanced way? And one really important part is to begin with connection and establish trust with the family, because they're much more likely to talk about a very guilt-inducing topic with you when they know you're listening and you're going to try to understand them. Another key is respecting kids' perspectives on this issue. We often come in a little bit bossy and say, like, why are you on your phone? Instead try, hey, what are you playing? I do this all the time when kids are on a device in my exam room. I say, what are you playing? How did you find that? Even if it's a terrible looking game, I still try and act positive and say, like, what do you do when ads pop up? What do you think of that? How did you find that? What are the rules that you have in your family about technology? And sometimes kids will say, I don't know, I just found it. I just clicked on it. And other times parents will say, I don't really like the games he finds. And I'll say, well, let's talk about other ways to find good content that are worth his time. So those are opportunities for conversation. And it helps role model to the parent how to have conversations and listen without rushing to judgment or shaming. When parents are stressed about a topic, they come in hot, as we say, like they're just like, wow, we need to control this. So you need to role model for families. Let's just talk about this. I want to learn more. I am curious. And acknowledge that there are no simple solutions or quick fixes. This is going to be a process of trying and experimenting with little changes in your family to try to get to a better place. Okay, I'm going to go through a little bit of the science, starting with child, and then at the end of that, I'll show some resources. So focusing on the child is important for 2 reasons. One is that we have to understand the child's perspective in order to meet them where they are and intervene successfully. If you recognize the function or reason a child is using media, you're much more likely to help them find alternatives or find a healthier way to do that thing. The other reason is that there's this interplay between who that child is and how much media they use that shapes their outcome. I really love this study from the UK. It's following about 10,000 children in their teen years. And they found that there's a bi-directional relationship between social media use, the number of hours per day spent, and mental health. So they ran 2 separate models and then mapped it out by the age of the child, and they stratified by female on top and male on the bottom. But there was you could see that having a lower life satisfaction led to more social media use. So that's an inverse association, and that's why it's under the 0. And that was most distinct between ages 13 and 15 for girls. So if you're unhappier, you use social media more. But the same was true in the other direction. The more social media girls were using between ages like 11 to 13, 14, the worse life satisfaction they had. So for this reason, we are recommending surely that kids do not start a social media account before age 13. And then maybe even consider, when is it time after 13? You don't have to open it right at 13, but certainly many, many kids are starting Snapchat, Instagram, TikTok accounts before age 13. And we're working with families to try to find other things for their children to do, to connect or to entertain themselves, because under those ages, it is linked with worse outcomes. Now in males, it's more the 14 to 16 age range when teenagers have a worse association between poorer life satisfaction leading to more social media leading to poorer life satisfaction. Maybe this is because puberty is a little bit later in boys and they're doing a lot more body comparison or risk-taking behaviors, but important to know that even after 13, it's not all great. And so that's why we're advocating for more regulation, so that in the teen years especially, social media is a safer place for them to be. They're not being introduced to as many dangerous challenges or negative information or hate speech or other things. And now on a population level in the United States, correlations between time spent with social media and mental health symptoms are pretty small, but correlating on a population level doesn't make as much sense because kids are so different from each other. So when you lump it into studying person by person, there's a subset of teens who struggle more with social media and their mental health. And in one group of studies in Europe, they kind of texted a teenager every single day about the amount of social media they used and about their mood. And in different studies, 18 to 30% of teens had a correlation between negative mood and the amount of time they spent with social media that day. Now that we don't know causation, but we do know there's something going on there with those teens where this is a more difficult relationship for them. And the other teens, it didn't matter to them as much. And maybe those teens have healthier relationships with peers or their family, or they have other activities that they have opportunities to be involved in. This other group of studies looked at clusters of teens who have more negative or risky social media experiences. And again, about 2/3 of teens did well. There wasn't a big correlation between social media use and mental health, but in about 1/3, there was more problematic use. And this was associated with existing mental health issues, less supportive home environment, and more parent social media use. So these difficulties are clustering together, and we have to address them all together rather than just saying, teenager, take your phone away. Now, in this subset of kids, it can become a problem. Problematic social media use, or what some researchers call more of a social media addiction. At the Center of Excellence, we use the term problematic because that's what teenagers tell us. They like that sound better and it feels less shamey. So this is heavy social media use with preoccupation, compulsion to use it, persisting despite negative consequences like sleep, money, harassment, conflict. And this is estimated to occur in a smaller end of the spectrum of adolescents, but still that's pretty high. I mean, that is up to 7% of kids seeing in your office who are struggling. and they are more likely to have depression, anxiety, stress, and ADHD. To treat, you can't just take the social media away. You need to make sure all of these underlying conditions are treated, probably therapy, and making some media use changes. Kind of like food-related binge eating disorders, you can't take food away entirely because kids need to use technology for school, or they may have to use certain apps for their sports teams, or they still want to follow their favorite musical artists somehow. So try to find ways that they retain those kind of healthier uses of media and reduce some of the more compulsive uses. You can screen for problematic media use using a validated scale like the Prius. This assesses the consequences of internet and social media use. The American Academy of Pediatrics has not yet recommended a specific screening scale like this yet, but our center is working on kind of a toolkit right now where if you screen with this, then kind of some follow-up ideas of what to do to help teens is kind of links to each of these specific questions if kids are struggling. Now, at the end of each of these 5 C's, I'll have a few ideas of questions you can ask. And basically, to sum up the first C, the effects of media are different for every teen. So you've got to get to know the patient, how their unique personality influences their media use. You can think about that with yourself or your family or your partner. What motivates them or you to use social media? What else is their day like? And how does social media fit in? And what is it getting in the way of? So I include questions like, tell me about your day. What do you do when you get home from school? What drives you to use social media? How do you feel after using social media or video games, if that's what the child is using? These are just a few examples of things you could ask. All right, moving on to the second C, which is content. This is really important to ask about because content does shape whether a child has a negative or a positive experience on social media, and it's complicated. This is about 7 years old, and it was a survey of teens and young adults in the UK, but people have mixed experiences on all these platforms. Some of it's positive, some of it's negative. So part of our goal is to have the ratio of the more positive outweigh the negative experiences they're having. So what are those positive experiences? It's mostly positive, helpful information that kids are getting on social media and affirmation and finding their people. So social media platforms allow youth to share their interests and activities through text, videos, and images. And this type of self-disclosure can, especially if they're authentic about who they are and they're connecting authentically with people, can help teens better understand who they are. And this is best when it's kind of a known social circle to you, not necessarily strangers. But for young people who are gender and sexually diverse, social media is a place where they have reached out to try to understand themselves better without as much stigma as they might be experiencing in their local community. So we give an example of Trevor Space is a nonprofit run by the Trevor Project that is a safer social space because humans moderate everything that's going on there, so there won't be harassment. And then just some other examples I've heard about from my patients are like anime illustration groups that they love to follow on TikTok, or Black Girl Nerds was a group that of young African-American girls who just couldn't find people like them in their communities. And so they connected and found resources together online. Now, negative content has been studied a lot more. And the biggest one that teens are worried about is bullying. And over almost half of them experience bullying, harassment, or aggressive behavior via technology. So this is also worth asking about. And it's important because being a target of cyberbullying is linked with substance use, worsened mental health, worse school performance, worse life satisfaction. People feel really alone and really ashamed when they're being bullied. So we encourage a lot of communication that's open-minded between parents and kids to say, like, how's it going? Who's being a jerk to you? How can I help? Especially teens from marginalized communities and identities are more likely to be bullied online, and it often co-occurs with bullying offline. So we often hear of like kids in schools where they're fighting in person, but then they're doing things like taking pictures or videotaping each other and posting it online. Another source of negative content that we want families to be aware of is body image and disordered eating content that can lead to lots of negative social comparison, over focusing on image, ideas for disordered eating, unrealistic beauty ideals, or overuse of filters, which is associated with worse self-esteem. So worth asking about that. Kids can run into and they can search for lots of harmful content, including pornography, child sexual abuse material, self-harm depictions, violence, accounts selling illegal substances, or contact by people who extort them in different ways. So this is a really important reason why we tell kids to keep their social media profiles private. So some random adult can't contact you and try to get you to send nude pictures. There's also some disturbing reports about how teens are generating their own intimate imagery to kind of sell online or to get fans on social media. So another reason to keep accounts private and not normalize this idea of, you know, that you need to perform online to get all these followers and get all these likes. We really want kids to have other ways to feel meaningful and connected in their offline lives. So it's important to ask about content because it shapes whether teens have positive or negative experiences on social media. So I ask questions about who do you follow? What types of games do you play or watch? Do you, when I say filters here, it's not like the facial beauty filters. I mean, do they have settings on their phone that kind of makes, like in TikTok, you can do restricted mode. For some of the parental control apps, you can put pornography filters or other things so that it won't show up on kids' phones. So this is a lot of questions. I apologize for that. But it's just an example of getting kids' opinions about what social media or who they follow, and then ask them what they like and what they don't like. Kids definitely have things they don't like about social media. And it's good to get them to be thinking critically of like, well, that's not okay that someone said that to you, or that you got bullied, or that someone posted such unrealistic beauty ideals. Ask about whether they've set up any parental controls on the phone to keep negative content out. As I said before, I always ask what age they said they were on their social media account, because if they say they're a teen on certain platforms like TikTok or Instagram, it will automatically filter out some disturbing or negative content, and then keeping their account private. Okay, moving on to calm. As a researcher who focuses on social emotional health and self-regulation, I really am glad that this C made it into the 5 C's, because I see families using media to calm down and escape a lot. And we want to make sure, now that's normal. We all use media to check out or relax after a stressful day, but we want families to have other ways that they calm down, that they know how to breathe, take a walk, be with their pet, talk with a loved one, and that media isn't their only coping strategy. Now, in little kids, we've seen that lots of families use media to calm kids down when they're overwhelmed. I'm going to talk about teens more. Here's a few examples of a recent survey and study we did with about 200 11 to 17-year-olds. We asked them a few of these questions about technology management challenges. The 2 I circled are you short of sleep due to being on your phone or the internet at night? The 2 green are the ones that are kind of sometimes and often. So you could see, over 65% sometimes or often short of sleep during the phone use. And then do you use technology to escape from your sorrow or get relief from negative feelings? Also, almost 70% said that. So I think we all could probably say that sometimes, but we really want kids to, number one, be aware of this practice, because sometimes it's just very habit driven. And number 2, think of, does it actually make me feel better when I do that? And number 3, what else could I be doing instead of just looking at my phone? So when we tracked these 200 kids' phones, we found that what were the apps used most overnight were social media, mobile gaming, and YouTube. So those are the ones that kids use to just calm down, see funny stuff, and let their brain calm down and rest. And they say, we interviewed teens who said, yeah, I use phones and social media to calm down after busy, stressful days. I just want my brain to calm down. So one solution is to try to make kids' days less stressful and help them do things like breathing, listening to music, reading a book at night instead. Now, there are apps to help teens self-regulate. These might be a better solution than just staring at a social media feed, because although teenagers may look at their feed to calm down, social media can always deliver a surprise because there's something random that shows up in your feed. So there is an evidence base for meditation or mindfulness apps and video games. For example, a 12-week randomized controlled trial of college students using an app like Calm or Headspace for only 10 minutes a day had some pretty large improvements in stress, mindfulness, and self-compassion. So these are skills that are helpful for kids to learn when they're teens, so that when they're adults, they are not yelling at each other every time they get stressed out or trying to withdraw. So what can you ask about the third C of calm? See whether the child is using media to escape negative feelings or fall asleep at night, and what other self-regulation skills do they have that they can use for relaxing. So I've been asking kids, what is your calming toolkit or toolbox? Like, what do you do to calm down? How do you relax when you're feeling stressed? And if all they say is their phone, then I say, what else could you do? There's lots of ways that your body can relax. Do you like music? Do you have a pet? Encourage them to keep the phone out of the room at night, turn on do not disturb or nighttime settings, talk to their friends about not expecting to be on their phone and responding to texts overnight, because that's a big reason that kids say they feel compelled to have their phone by them. And then just trying to assess, this is one area that's very hard to change in the families I've worked with. If their child falls asleep to media, that they kind of don't want to mess with that. So I recommend, well, maybe make it a soothing white noise or a sleep story where it's more meditative and not just something that could be overstimulating. Okay, so for crowding out, this is one of the most important mechanisms by which media is linked with worse outcomes. The more time you're on a screen, the less time you're doing other healthy stuff. So that's where the original screen time guidelines came from. So it's not that there should be no screen time limits. I still encourage families, decide on your own. Is it 30 minutes? Is it an hour? Do you have a 2 to 3 hour limit over the whole day? That's something for you to decide based on your family's day. But sleep is one of the most important to have boundaries around, because sleep can be negative impacted when teens postpone bedtime so they can use social media for entertainment, like we just talked about at the end of that big, busy, stressful day. But it can make you psychologically aroused. It can make you emotionally, and even your physiology can get more worked up. It, gets your attention, it gets your heart rate up. So we have to help kids be aware of the fact that when you are on your phone, your body is alert and sometimes excited, and that's going to make it hard for your brain to calm back down to go to sleep. And to address the motivations for nighttime use, like I said, fear of missing out, feeling social accountability, meaning I need to be there. My friend's going to text me. They're going to think I hate them if I don't text them back. So I'll say to kids, okay, talk to your friends. You all want to have a good night's sleep so you can focus in school, right? So can you all put some settings on so you don't get notifications overnight, and then you won't be feel sad when you miss something. Another important part of crowding out is school. So I don't know what the school policies for phones are like in Mexico, but in the US now there's lots of new policies going into effect. And the reason is that phone use in schools generally is disruptive. It can be used for learning. Many times it's used for kids coordinating with each other or with their parents. But overall, the research shows that notifications and the temptation to check social media, video games, or online videos can interrupt learning. Kids say, I do it because I'm stressed out and I just want a distraction, but it's just too tempting sometimes when school feels too hard. But phones can also be used for bullying, like taking photos or videos without permission, or sending abusive texts or images, or planning fights. And US teachers are exhausted. They are sick of phones and they are wanting to not be arguing with them about kids all the time. This is a graph from that study where we tracked about 211 to 17-year-olds' phones. And then we looked just at school hours, and we saw social media was used for an average of, you could say it's like 15 minutes per school day. So it's not enormous, but it's what dominates the time. And a lot of that is in all of these bite-sized messages. And then YouTube. So some kids just wanting to veg out and watch some YouTube or play a video game. All of which are not necessary for the school environment. So that's kind of the point here, is that you can see like reading or making phone calls or listening to music were actually much less common and took up a shorter amount of time. Now, there's reasons, like I said before, that it is hard to stop using technology, and that leads to more crowding out. If you just pick up your phone, you may get stuck in a loop because it wants you to stay on so it can make more advertising revenue. And that's how they make more money. And because there's so much competition for your attention, it means it's so hard to look away. Like, oh my goodness, someone posted that. What does that mean? Even the news is filled with things that are hard to not click on. And when an algorithm is predicting what you might want to watch next, it's hard to resist. So we tell families, really understand there's design reasons that you don't want to stop using your phone and that your child doesn't either. Here's some screenshots from my research at University of Michigan. We analyze the designs that keep kids playing games longer. It could be daily rewards. It could be a notification from the character saying, come back to the game, we need you. It could be all of these clickbait kind of images on a YouTube recommendations feed. How can, if you're an 8-year-old, how can you not click on one of those videos? What's going on there? Poor family turns rich. I need to watch that. Or these kind of frictionless, like little reward-driven reasons that we just have gotten kind of trained to stay on technology longer. So what you can say about crowding out is to say it's normal that you wish you spent less time on technology every day. Acknowledge that and say, let's think of other activities you want to do. What do you want to like crowd back into your day and say, I'm going to use less media so I can do more of this thing I love. I'm going to cook, I'm going to dance with my kids. We're going to read more. We're going to take more walks. And you have to build that habit over several weeks. Don't expect that just one weekend is going to change everything. And then talk about how it's getting in the way of things like homework or socializing, and let kids know that's because it's kind of trained us to want to come back again and again. All right, and finally, communication. Here's where we have a bunch of resources from this Center of Excellence to try to meet kids where they are and have open, helpful, productive conversations to encourage behavior change. And one thing I love about this book called Behind Their Screens, so this was written by two education experts at Harvard. They interviewed hundreds of teens about their digital lives, and they uncovered a lot of kids saying, like, this is hard. Like, you're constantly being alerted to everything. Everyone seems like they're far better and, awesome than me. Sometimes I just can't get off a computer game. Sometimes I feel stuck. If we create a space to show that we're listening, kids will tell us this stuff, and then we can help problem solve with them. But if you just come in and say, you're staring at your phone again, kids will not talk. They just will be like, stop judging me. So we want to focus on the teens' experience, start conversations even with younger kids. They have opinions. My research, we have interviewed kids as young as 5 about technology. They sometimes have misperceptions about what things are, or you could see how likely they are to just get obsessed with online games and coins and influencers and stuff. But at least you're trying to understand what they're vulnerable to. I've already talked about some of these conversation starters, like what do you like about this? How does it feel? I like this question, what's the creepiest thing you've seen online? Kids like to talk about stuff that has popped up in their feed. The key is make sure kids know they can come to you, meaning to parents, about their experiences online, even if they feel embarrassed or worried. So this is what has happened with if they see pornography, if they send someone a nude picture and then that person distributes it, it's so shameful to them that they don't want to talk about it. And they think parents are going to just overreact and yell at them and blame them. And so part of us, what we're trying to do is shift the conversation so parents can say, I'm listening. I'm going to get upset, but I'm going to try and control my reaction. And I'm just going to listen and help you because I love you and I want to help you. And then caregivers should talk about their own media use because we go through a lot of this too. So partly when you're in the exam room with families, you may even see the dynamic around media use with a parent kind of saying, put your phone away, or a kid or a parent on their own phone, and both of them kind of ignoring you. So see who is setting boundaries. Are they enforced well? Is the child contributing to problem solving? Is the child sneaking or hiding media? That can sometimes suggest that the parent is being a bit controlling, and then the child is trying to sneak so that the parent doesn't know. So ask open-ended questions like, does your family have rules? What are they? What do you think of them? What do you argue about? How do you solve those arguments? You can ask kids, what do you observe about your parents' phone use? Do you wish that would change? This is just a quick sample, but here's a resource we have called Conversation Starters that gives you a bunch of ideas by topic. And then we also created this companion resource for kids 10 and under, because they aren't necessarily going to have conversations. They may just need to have little activities to help them understand things like why it's so hard to get off of media or why some influencers are showing off. We often get asked, should teens delay using social media? So I already talked about the fact that under age 13, there is some growing evidence that is not good, that kids who started social media account early had worse outcomes, including more contact from strangers, more problematic, meaning compulsive usage habits, more body image dissatisfaction in girls. Okay, so even if you get a phone sometime between, 8, 9, 10, 11, 12, doesn't mean social media can be installed on that phone. So make sure phones have some, like the parent has to authorize any sort of downloads or purchases. And like I've said multiple times in this talk, teens should be honest about their age online. It's not perfect, but at least it stops some of the really bad stuff like strangers contacting them through direct messages. If kids are like, no, I want to be on Snapchat, everyone else is on Snapchat, you could ask, okay, how else can we see these kids so you don't feel so left out? What other messaging apps could we use? And really talk about the pros and cons of social media, like I've reviewed today, is that, some of the cons of it include getting too obsessed with it or seeing negative content. So if a family does start one, set limits, check in regularly, and then use, let me show you in our resources, we have some ideas for how to do a family center where you can link accounts. Sorry, I'm going to advance just to a couple slides. So on this glossary of digital media platforms, again, I will send this link with kind of our other handouts. Right now we have 7 different platforms up on this glossary. We are adding more. But if you click on, say, Snapchat, you can learn what sort of age-related filters they have, what sort of privacy settings they have, what sort of family settings they have. And this helps families understand. Many of them don't know about different settings they can do to make it safer. Okay, backing up, here's some other resources. This is our website, aap.org/social media, where we have links to these 5 C's handouts. We also recommend people take a look at the AAP Family Media Plan, which is a couple of years old, but it does have some tips for setting boundaries around tech. I tell families to sign up for the Common Sense Media newsletter, where you get some articles that keep you up to date about what's going on in the digital world. I also like these resources, Center for Parent and Teen Communication and the Boston Children's Hospital Digital Wellness Lab, which gets more into problematic use. I know we're getting close on time, so I'm happy to share these slides too, because I know these links are all in here. This is just a screenshot of the family media plan where you kind of enter kids' names and ages to get some tailored guidance. And then we have a question and answer portal on our Social Media Center of Excellence website, where if you don't find what you're looking for, we just got a really interesting question about like, what are the effects of AI generated sexual imagery on kids' psychology? There's not a lot out there about this. So we do a literature search, and then we write up an answer and send it back within about 2 weeks. So it's all evidence-based, but we try to make it very strengths-based, like I've been talking about in this presentation, so that it is, not shamey, blamey, very focused on what you can do and how you can help your kids. Okay, here are my resources and just an acknowledgement to SAMHSA, our funder, and I'm happy to take some questions.
Thank you, Dr. Jenny. So we got some questions. I think that the first one here in the chat just got answered with your last couple of slides about resources for parents. So I think that one's great. So one of the questions also that we have is, what are your thoughts or what are the recommendations? You were talking about how to talk with kids about social media, but about checking in on their social media, their messages, what are they texting, the content. So when should parents be checking in? When do they connect apps? So yes, that sense of privacy versus
That is right. That's the hardest question, is like, we want to give our teens developmentally appropriate independence, but we also want to make sure they're not running into problems, and we want to monitor. So let's talk about it from a slightly younger age. Like, let's say a child is getting their first phone. I think you start with an agreement of, I'm going to know the password to this phone, and I'm going to check in on how you're doing and what you've downloaded, what you're playing. And I'm going to, we really recommend that you do some sort of pairing. Like if you all have iOS phones or Android phones, I'll include some links to that. Apple has like a family sharing plan that works well to either set time and content limits, purchase limits, things like that. It doesn't do the in-depth monitoring of like, what did your child text someone else, but it's at least a good place to start. And then Android has Google Family Link that has similar settings. Then there are third-party apps like Bark or QStudio or others. Life 360 are a couple examples that do a little bit more invasive monitoring of like texts or content. Like basically you can see a lot of what your child is doing. My recommendation about that is you have to talk to your child about what I'm monitoring. Do I know your location? Do I want to see what you're texting other people? Because teenagers tend to find those apps to be kind of like spying on them. So you really need to have a conversation about it if you're going to set one of those up. And then a regular conversation, like let's say a child already has a phone and social media and doesn't have any of these accounts set up, I would encourage, sit down in a conversation and say, I've been hearing that social media can have, some negative things like bullies, strangers trying to contact you, or creepy content. Kids don't like any of these things. So you can get some buy-in to say, listen, there might be some settings we could do to make this better. Do you experience these? Do you want to try to set up an account where our accounts are linked, and let's see how that goes. Treat it like an experiment. Let's see how this goes, if it makes things better for you. And then the last thing about, what about an older child? Should you still be checking their texts. I think that really depends on your level of concern about them. If you have a child who has depression, has been suicidal in the past, who has been getting into eating disorder content, you may want to do more intense monitoring where you just have an agreement with your child's that I will occasionally check in with you about how it's going. I may occasionally want to look at some of the stuff you're looking at. I'm curious. I want to help you. And not making it a control situation. But then if you have started with this baseline expectation of, I'm going to check in with you, and if you're acting responsibly and things are going well, I'll check in less because I'm building trust and you're building responsibility. So the easiest way is when you first get that phone or device, you start things with a bit more control, like a little bit more lockdown, a little bit more restriction and monitoring. And as you get more comfortable that your child has a healthy relationship, you can let go a little bit over time and tell the child, hey, if I see you being responsible, I'll stop checking in as much, but I always want to know how you're doing.
Right. Yeah. And in that sense, there's another question which you already shared, as I was saying, some of the resources, but are you aware of any of those resources where there are some like webinars or short video clips for parents? You know, right now they're just looking for shorts.
Yes. So I think probably Common Sense Media is the best for shorts. Let me find a few and I can send it to you in an email. Most of our stuff so far from our center has been a little bit longer, like a webinar
Okay.
or, lecture. So great question. And it also motivates me to tell our team, like, we need some shorts to help engage
More
the
work,
families.
more work.
Yeah.
Yeah. Great. And I think just a last question, which probably falls a little bit out of the full scope, but some of our audience know all of the work that you've done. And one of the questions is, what are the pros versus the cons of reading on paper
Yeah.
versus reading?
Oh, great. Yeah. Awesome question. So it depends on the age. Like we've done some research of toddlers showing that when they're like doing shared reading of a book with their parent, it's much easier on print because the screen has a lot of distracting kind of bells and whistles that they just want to click on. And that they grab the tablet and kind of move it away from the parent instead of a book, they kind of snuggle together. So we definitely recommend with younger kids, the book is just easier to read around and share the experience. When kids are in school, if they're using a reading app that's kind of training them and teaching them, a lot of those have good evidence. So parents shouldn't be worried about reading on a screen in school a little bit to kind of do some practice. But kids should also get a lot of practice reading on print, let's say at home. It's just nice quiet time, and it's great to be able to go to the library and get a new selection of books so that kids get into the mental habit of, I'm just going to sit in my bed or on the couch and, enjoy these pictures or stories. And then studies in more like teens and college age students show that people remember more when they have been able to kind of read a book and like go back or take notes or underline or do the other sensory work that we do while reading. It doesn't mean that reading, we read so many articles online every day and like you can still do things to remember things, but from them, like highlighting or taking notes. But I think overall the consensus is that reading on print, especially like a physical book, there's a little bit more evidence for retention and less distraction.
Great. So thank you, Dr. Radesky. Even though there are some more questions, the goal was to have you here with us, and I think everything went pretty awesome. So thank you very much.
Great. Thank you so much for inviting me. I'll send those resources later today.
Thank you.
Okay. Take care, everyone.
Thank you. Bye-bye. La próxima sesión tendremos al doctor Charles Albright, psicólogo de Nationwide Children's, con el tema de trastornos del aprendizaje, algunas consideraciones para pediatras. Entonces los esperamos la próxima semana.